Hi everyone, welcome to today's video. Today I'm just sitting here holding a phone in my hand to do this video. Still in my nightgown because I wake up at 1 o'clock in the afternoon because I'm a night driver. And that's going to change soon because I have 2 jobs now. But anyway, so today's topic is on a positive note. Lyft is getting more involved in medical transportation, which is a really good thing for drivers because what it means is there is more work to go around. It's an opportunity for Lyft and an opportunity for drivers that way. And acquiring all these medical contracts that they have been and are working towards is a way for them to potentially be able to start showing a profit or have a sector of their, services that actually can potentially show a profit. This is a really good thing because the reality is these medical contracts are they're contracts, and the contract is between Lyft and the various healthcare providers, and in some cases doctor's office, but usually most of the doctors these days are not big enough to have an account with this type of a provider that's as big as Lyft, and they're under the umbrella of a bigger healthcare company. But it is a good thing in that way because these contracts have like 7-figure value to them. Lyft already, this is nothing new. First of all, this is nothing new in terms of this is not Lyft's brilliant idea to provide services within the medical community. The cab companies and livery companies have been doing it already forever. Lyft just, apparently got that this was a sector where there is a need for providers. Very often the reason that people are being transported for medical purposes is because they have no other way to get there, or they cannot drive because the reason they're going to see the doctor anyway. So it's some doctors' offices would comp, their patients' rides. Like I once, when I went for an MRI, the doctor's office actually did, quote unquote, sponsor the ride. But no, very often it's your taxpayer money that's sponsoring these rides because a lot of these contracts are welfare contracts. And I can tell you that's a fact in Phoenix because, again, I've been in the industry 28 years and I've run these rides. They're about 80% of the day business for Discount and Yellow Cab. Between the 2 companies, they have contract with all the providers. Mercy Care being the biggest, which Lyft already has here in Phoenix. And I can tell you that if you're a day driver, you're probably already running Vouchers if you realize it or not. If you're a day driver here in Phoenix that's on the Lyft platform, the way to tell that you're running a voucher is if the ride says that you may not add stops and you may not change the destination. that's going to be your giveaway, that it's a voucher. I don't know if they're all done like that, but the one that I got, it was pretty obvious it was a voucher. Again, I know the demographics of the people that I'm going to be transporting on the vouchers, and I know where a lot of the medical facilities that the unicorns come out of. I don't drive days, and I would have to relearn this all over again. And when I am in my own vehicle, which I'm not at this time, I'm leasing. I might just do a series on that, finding where the medical unicorns are in the Phoenix market, and we'll see. You know, selling trade secrets is not exactly, something that I agree with, and we'll just have to see. But yeah, so Lyft has already gotten the major medical contract, which is Mercy Care here in Phoenix. Again, this is really good for our day drivers. It's like, that was a portion of the work that was the only thing left for discount cab. And, gradually other smaller companies started getting more of a piece of it. And they just, because of the whole situation, they just can't cover those rides anymore. They don't have enough drivers. And the reason they don't have enough drivers was the trickle-down effect of Uber and Lyft coming to town and basically, having a system that was cheaper and more efficient for riders. Cheaper being the key word here. That's how they got the monopoly, by training riders that we're only worth $1 a mile on the passenger paying side of the gig. So don't forget that, people. These companies trained their passengers and the people that you're picking up that we're not worth anything. So, now that you're sitting there, wondering why they can't pay us, that's one of the reasons. There are other reasons, which I will get into in other videos. But yeah, medical transportation, any place that they can get business from is good for us. The more business they get, the more business there is to go around, the more drivers they can support, the more they can begin to show a profit, and potentially, maybe one day, we'll get a 10 cents a mile raise or something like that. Alright, anyway, that's my piece for today. I am getting up to the 10-minute mark. I am staying focused on my videos being short and sweet because I don't have time, and neither do you. You just want to hear me get to the point if you're listening at all, and then you want to move on to other things that you have to do. So I appreciate you being here and listening, and please go ahead and hit the like button on this video and subscribe and hit the bell for updates. And everybody, you have a great day. Thanks.